I'm going to scan the room for you. So today we're going to do pediatric medication administration. We'll talk to you a little bit about that. You know, I would do my general safety practices, hand hygiene, that kind of thing. I've already got gloves on. I would be putting them on yet, but I've already got them on, so I'm just gonna leave them on. You know, when I walk into the room, I wanna stay calm. I want the parents to know what we're doing. I want the patient to know what we're doing, especially those that are of the age of knowing what's going on. An infant like this doesn't really understand what's going on, so you know, I want to prepare this family for what we're getting ready to do, whether it be, you know, maybe an antibiotic, or maybe we're going to do an injection. I mean, just different things. I mean, we can give, you know, oral pill. We can do suppositories. We can do eye drops. We can do ear drops, nasal spray, things like that. So a topical cream, things like that. So I want to educate them on what we're doing. You know, when I prepare the medication, I'm only going to prepare it for one patient at a time. I don't want to get so many different ones and you have a chance of getting medications mixed up. Whenever I do prepare those medications, I'm going to use my 6 routes. I'm going to make sure it's the right patient, the right dose, the right route, the right time. You know, your right documentation, right route. I mean, just everything that I can do to make sure that this patient is safe, make sure that the medication is for this patient, and make sure that, you know, they get the proper care that they need. I want to do 3 checks. I'm going to get that medication. I'm going to verify the order. I'm going to verify that it's the right medication. Then I'm going to check it with the MAR, which is the medical electronic ordering system. And once I do that, then I'm going to bring everything with me to the bedside. And once I do that, I want to make sure that this medication is for this patient. I'm doing a data, you know, name, date of birth. If they can't talk, I'm going to use the wristband. I'm going to ask the parents or the caregiver, whoever the legal guardian is. You know, so I want to ensure that this patient is safe. Once I do that, you know, and depending on the patient, you may have to restrain them. So I know with the experience that I have, you know, smaller children are easier to restrain. Sometimes you may have to have a second person. Sometimes one shot can be separated into 2 because of the amount of medication. These little vastus lateralis, these muscles in these little legs can't handle that much, so you can split it, give 2 shots at one time. So therefore you're going to have an assistant to help you. You want to calculate that medication again, especially for the weight and that kind of thing, to make sure that you're not giving too much or not giving enough. And if you feel like that you can always have someone else to check it for you. As you get older, with the older patients, say those 3 to 10, you know, I mean even 8, 10, whatever, you may have to restrain them in a different order, but we want to do that in a safe manner. Sometimes you can cocoon them in a sheet, or maybe you just have to use a little bit of, you know, hands-on, and you know, have mom and dad if they can help, or maybe get some extra help in with you to hold extremities and that kind of thing, just to hold them until you get the medication. You know, they don't really realize what's going on. It's a traumatic experience. We want to keep that to a minimal. And we just want to ensure the safety of the patients. So, you know, as they get older, you can use the deltoid in the arm, vastus lateralis in the leg. Both are fine. But today, I'm going to be using the vastus lateralis. So, like I said, I've already checked my MAR, checked out my orders, made sure that this is the right patient, made sure it's the right dose, the right time, all the 6 routes that I need. I've already checked that and made sure that that's been properly done. So to get started, what I'm going to do is I'll expose this area, the anterior part of the vastus lateralis. I'm going to get me now I would get my Band-Aid and have it ready on my hand, but I'm not going to open it up just because this is a a baby doll. So I'm gonna clean the site really good. I'm gonna let it air dry. I'm going to remove my syringe with my needle. Now, I'm going to do an IM injection. So with this IM injection, I'm going to go straight in a 90-degree angle, all in one motion here on the vastus, here on the side, boom. I'm going to aspirate a little bit, make sure that there's no blood. I'm going to give the injection, pull straight out. I'm going to engage my safety mechanism. I'm going to throw it in the sharps. I'm going to put a Band-Aid over this. I'm going to rub a little. You can rub this muscle a little bit. It'll help that a little bit. The big thing I know with the infants, in my experience here, is, you can give these infants back to their parents or their caregivers. Let them console them. Sometimes that'll help. I know with my own children, it did with me. But overall, you want the patient to be safe. Now, if I was given a shot to where I would have too much, if I've got, if you got 3 mLs, you want to separate that. You want to make sure that you put 1.5 in each one, or you want to break that up so that little muscle doesn't take all of it until they get a little bit older. So therefore, you would have to have another person come in. You would hold that patient and at the same time give injections. Okay. If you're going to do a sub-Q, you want to go to a 45-degree angle. Today I was using a 25 gauge. Anywhere from a 23, 22, 25 gauge is appropriate. You want to, IM is 90, sub-Q is at a 90 or a 45-degree angle. You can use the same needle. Most of the time you're using a 5/8 to 1 inch on these. As they get older, you can move up to a 1 inch to 1 1/4, depending on the patient. Let the age appropriate, let the age of the patient tell you the appropriate material to use, the right stuff to use. So now that I've given this, what I want to do is watch this patient for the next 15-20 minutes, make sure that there's no adverse effects, make sure that there's no reactions. I'm going to explain to the parents that there could be reactions, and that's why we want to hold them and make sure that nothing's going to be, nothing's going to happen. Once I've got all that done, I'm going to record, I'm going to report, and I'm going to do my hand hygiene and clean up my mess. Also, not ever going to leave any medication by the bedside. We'll take that back out with me. And that'll conclude our pediatric medication administration.